Anthropometric measurement is one of the important basic measurement in the nutritional assessment. Mainly from the when the baby born, we are using. It is very cheap and effectively simple technique the nurses and other people can learn and easily assess the level of the nutritional status, which is mainly containing the checking the weight of the baby, height of the baby, and the chest circumference and the mid upper arm circumferences. So in this class we are clearly going to see what is the techniques of measuring these doing these anthropometric measurements in a community setup, as well as how the simple things you have to learn in this class we will see in clear manner. Anthropometry, human measurements. Main purpose is to find out the nutritional status, find out the growth and development of the children, especially for ICDS program, government. It's a simple way to measure the malnutrition. Find out any deviation from the normal in the growth and development. And main advantages of this anthropometric measurement, it is non-invasive. It is very less expensive. Minimal things are needed less training, and reading and is reproducible. Again, you can read and show them. Its objectivity is there, sensitivity is there. Any test, any diagnosis should be objective and sensitive, and its high specificity is there. Readings are numerical and it's gradable. It's like for example, if you take here BMI. What is BMI? BMI is a body mass index. What is the formula? Here you are using is a weight in kilogram, height in meter square. So WHO BMI category we are doing it. How we will do? Any person's height we have to check, as well as the weight. Weight you will put in kilogram in meter square. For example, 155 centimeter, 1.55 is the meter, then the whole square, 1.55 the whole square. When you do, there is a result will be coming. If this result, which category it is falling? If it is less than 16, it is severely undernourished person. This BMI calculation we are doing it for adult. We will see what is for the infant and the children, we can see next. And 16 to 18.4 is called the underweight. Normal range is 18.5 to 24.9 is the normal. 25 to 29.9 is the overweight. 30 to 34.9 is the morbid obesity. 35 to 39 is a severe obesity. The 30 to 34 is a moderate obesity, not a morbid obesity. I told you morbid, it is a moderate amount of obesity. Above 40 is called the morbid obesity. So this is the one. So to assess the change in the body composition or the weight. Okay, and another way also they will measure. What they will do, in the height they are checking 155 centimeter. In that they will minus 100. If you take 155 centimeter, 55 is the normal weight, they will tell. 5 or 5 kilos extra or little less, it's not a big deviation. People will be normally will be saying, but actual calculation BMI for adult, this is very good. The other anthropometric, mainly what we are telling, height, weight, mid upper arm circumferences, and the arm span, how it's there, and knee height and sitting height, skin fold thickness, this one, and head circumference. So these are all the main anthropometric measurements. In that what we are doing, height, weight, mid arm circumference, chest circumference, and head circumference is the mostly we are doing it. So if you see the children mainly we will go for the Gomez classification. So what's Gomez classification? He is talking about some expected weight formulas. For infant, if you take age in months, for example, infant is a 2-month-old baby. 2 plus 9 divided by 2. So you will get one number. This number is called the expected weight. But actually actual weight will be there. Then you will apply the formula. What is the actual weight divided by expected weight into 100. Same way, there are 1 year old, 1 year to 6 year. Infant is, what is that? Infancy. Neonate is 0 to 28 days or 1 month. 28 days. But infant is a 1 year. Above 1 year to 6 year, you can use this formula, age in year into 2 plus 8. These all coming under the expected weight only. 7 year to 10 year, age in year into 7 minus 5. Understand? So this expected weight can be applied into the formula. Actual weight divided by expected weight into 100. In this range is called 90 to 100 is the normal. 75 to 89 will be the grade 1 malnutrition. Then 60 to 74 is a moderate level of malnutrition. Less than this is a severe malnutrition. This one. So what is the step of step we will see how what is the step of this one. First step, you have to calculate the expected weight for any children or anybody. Second step, measure the actual weight. So first you calculate the expected weight according to this formula, then calculate the measure the actual weight and apply into the formula and determine the degree of malnutrition. And one more thing is called the height. Height also you can age in year into 6 plus 77. Understand? So this is the height. This is the way you can easily measure. The technique already we have seen. Head circumference means how you have to keep. We have seen in the introduction class. Mid upper arm also acromion process to the oligrammer process. In the midpoint you have to assess. Okay, only these formulas only will be the nutritional assessment. You always has to remember nutritional assessment not only anthropometric. It's a part of it. That anthropometric is one of the easiest, cheapest, acceptable, reliable, responsible, reproducible, easy way. Even it is followed up by the community. Community people can follow in their lifetime. It's a great health awareness one. Yes, of course. The other measurements or nutritional assessment also can be done. Biochemical assessment like urine sugar test. Some of the tests we are doing reagents, anemia also sometimes like this. And then clinical examination, clinical signs and symptoms, pallor, other thing, beriberi, or there is a beriberi, then the spoon-shaped nail, other thing. And then dietary assessment, 24-hour recall, or the what are all the dietary chart you can maintain, or cooked food and the raw food assessment also you can tell. And ecological factors is an important factor because ecology play a main role in our health status. For example, the Himalayan region people always getting a goiter. Some of the village, some people drinking the water, fluorine content is more, they will give a dental fluoride. So this is particular ecological factor will affect their health status. Not only we may tell our salt content is this, that is the problem. What is the problem? But salt content continuously, excess salt they are taking in the water, they may prone to get the cardiovascular diseases. Then will be the functional assessment. You can start with the Nelson's chart and abduction, adduction, pronunciation. So what you will do in that you can find out how the eye is functioning, movements, right or not, and then any gout or vitamin D deficiency, you can find out the functional assessment. So these are all the A, B, C, D, E, F of nutritional assessment also include in the assessment of nutritional status. But once you are doing anthropometric, you have to see the height, weight, mid upper arm circumference, chest circumference and head circumference, sitting and skin fold thickness. So mid upper arm, normal is mid upper arm, 12.5 is the normal range for the mid upper arm circumference. If less than that, it is a severely malnutrition, wastage of muscles. Normal is 13, you can say. So very severe, there is a scale. In the introduction class, I have shown you that there is a scale. That's normal is a green color. Red will be the severely this one. Yellow will be moderate one. So there's an anthropometric measurement. Whenever you are going to the community, you are carrying always with weighing scale. You motivate the people, ask them to memorize this formula. So throughout their life they can follow. If they have under 5 children, you write and give them formula. So themselves they can monitor their own children. That is called community based health awareness. So hope it is understandable. Thank you.